Akire muchamanio jurajo gukarentere chia Karen muchimunene jua Nairobi jwegie kwariri manto ja mubango jua sha wa mwana taifa kia jurajo gutongeretwe ni munini wa mukathe wa nthiguru ya Kenya Profesa Kithure Kindiki na ni aria atongeria bagwikinyetie barani bathirikari inene wa mwana kinya ba kaunti aria kinya ngavana wa kaunti ya Meru mukathe Bishop Kawira Mwangaza hagukari muchamanio ne jojo akiaria munini wa mukathe wa nthiguru ya Kenya Profesa Kithure Kindiki nombite kwithirwa akiuga thirikari ikomba kwithirwa ikienja na bilioni 7.8 cia gutigira ni gutetheria kiri utungata bwa mirimo iria mirito na nkuluki ni arombite kwithirwa akiuga kiri mubango juria jukethirwa jukiarirwa kiri mbunge nene kiume giki bilioni 3 ikomba kwithirwa igitumirwa kiri kutungatira mirimo eje mirito na nkuluki bilioni ingi 3 ikomba kwithirwa igitumika kiri gukiria cibitari cia matura na nkuluki haria bilioni 1.8 na chichikomba kwithirwa igitumirwa kiri gutungatira baria ni ekuru barito mona kutwana twao.
After listening to stakeholders, beneficiaries' experience, and members of the public generally, the government has adjusted in the interim the funding arrangements for the program through the supplementary budget to be tabled in the National Assembly tomorrow. And in that connection, the 3 areas that have been given additional funding include more funding to the chronic and critical illness fund, which is going to receive an additional 3 billion shillings, because the feedback we were getting from the public and stakeholders is that we needed to adjust the funding and the financing around chronic diseases and critical care cases. So through tomorrow's supplementary budget, we will be adjusting that fund by 3 billion shillings. Equally, the government has decided to again review the funding of the primary health care fund by another 3 billion shillings. And finally, the same supplementary budget will provide an additional 1.8 billion shillings to take care of maternity-related health services, including the issue of Linda Mama, and that includes our teenage girls and the pregnancies associated with teenagers. So that is a total of 7.8 billion shillings as a short-term adjustment to make sure that this program works for the benefit of the people of Kenya. The other thing where we need to make a lot of progress and rapid progress is in the onboarding of all health facilities. And that's why in our reconvened summit, we will need a clear output in the form of all the level 2, 3, and 4 facilities across the country being onboarded for purposes of capitation and for purposes of making sure that we sustain this program at those levels. I want to urge the 2 levels of government to continue working together. None of us can implement this alone.
Onkoloki Profesa Kithure Kindiki na ugite ni bachumitie anene gutigira akenya ni bagwitonyithia na guciandikithia kiri mubango juju juasha aria ni akenya milioni 19.5 nibo bombite kwithirwa bakiciandikithia kiri mubango juju aria baugite ni tagari ari nene bombite kwithirwa bagikinya bare thirikari kuona ati namba ira yombite kwithirwa igiciandikithia kiri NHIF ni ari inini nkuluki ya iria bandikithitie kagitene gaka kiri mubango jwa SHA. Ukiririkano ati kaunti ya Meru ni ari ya kaunti 10 iria ciombete kwithirwa igitongeria kibare baciandikithitie kiri mubango juju jwa SHA.
In terms of reporting progress, it is important for us to report to the country that the registration seems to be picking up well, 19.5 million, fairly okay, comparing that only 9 million Kenyans were registered before under NHIF. We still have issues, as was communicated by the chair of the COG on health, that in some of the data we migrated from NHIF is incomplete because only the principal beneficiaries are part of that system. And we need again in the next week or so to bring in the dependents, the other beneficiaries, the dependents of the principal beneficiaries, and we have to crack our heads and find out how we go about that. But 19.5 million, up from 9 million under NHIF in 4 months, 5 months, is a good trial. Secondly, that we, and when I say we, I mean the national government and county governments, have been receiving public and stakeholder feedback and taking that feedback very seriously. The evidence is first in the review of the means testing tool, which is ongoing and which has a non-extendable deadline of 28 February. We must have fixed the review process of the means testing tool to provide for an objective data-based tool that is not susceptible to manipulation whatsoever. An objective data-based means assessment tool that will give a clear and scientific assessment